So when you have something like this, new admissions, we are saying not all new admissions are highest priority. Okay. It depends on what they come with versus how unstable a patient you already have is. So don't always have it in mind that as long as the option says new admission or newly admitted, maybe so and so. So straight away you would go for that. Still try and look into the other options and compare. Okay. So this is a clear example. Look at this one. Which clients should the nurse see first? The first one says a client with a newly admitted client with C3 ESKD. You see, newly admitted. You see the thing? This person is newly admitted, but with what condition? ESKD. Stage 3. Compare that to option 2, client with sudden confusion and agitation. So this one can be a client that you already have on the ward. So between the two, which one would you choose first? So you see, we say prioritization questions always depend. Everybody who teaches English will keep on using this word, right? Those of you who have listened to McKay before, you remember some of the questions that he was answered. It always depends because they can put you in a tight corner. And how can you get your answer? You get your answer by analyzing the instance that has been cited or given to you or within which you find yourself. That is how you make up judgments. And the English to test you like in such manner, okay? They create a scene for you to solve the issue. So you don't always go with things like it is always like this, it's always like this. There are some things they are always like that. For example, white blood cell count. Normal ones should not be more than 11,000, right? Some books say 10,000, but up to 11,000 it's allowed. Nothing more than 11,000. No labs will agree more than 11,000 to be normal. So things like this, they are general. I mean, when you have them, you know that that is what is happening. But aside that, in prioritization question, they can just create a scene for you. They can give you an instance and they can put you there to be the nurse to solve that issue. So always try and compare how the question has been given to you and make your sound judgment from all that you've learned and all that we've gone through. That is how you analyze and get your answer correct. And we always say that what practice makes man perfect. The more you practice, the more you get it done. Okay? And at times you can make mistakes, can get some wrong or plenty wrong. It's part of the learning process. As long as you are getting them wrong and you are reviewing them. For me, I like the review part because should we get similar question elsewhere, maybe in the nearest future on the NCLEX, you will never spare it because you once had it wrong somewhere and you reviewed it. So should you get even a similar one, you can make application and get it correct. So that is the benefit of what we are doing. So if you are here and you are solving 10 million questions and after that you don't review, someone who solves just 10 questions and reviews them all properly has learned more than you who solved the 10,000 questions. So it's not about solving questions alone. When you review them, you know your mistakes. That is where learning takes place. Okay? So with regards to what we are trying to say on this slide, which client should the nurse see first? Between 1 and 2, we all agree that option 2 has a big issue compared to what option 1. But option 1 is just admitted. Okay, just newly admitted. So you can't always depend on newly admitted to choose your option as first. Also know what is happening at hand. Any question on this one? I think we touched on it a bit before we went, right? Any question on this one? Okay. Silence means consent, right? Okay. You remember yesterday I told you I'm going to ask you some questions. This is a a generalized form, okay, of prioritization. They are not too difficult, but I think we've been able to summarize all that, even if not all, more than 80% to 90% of what we should know under prioritization. So I have these questions for you to try for me. Let's see if we can get them. Who is going to be my reader for me? Let's take the first question. Who is
Yeah,
going to be?
read.
Okay.
A client admitted to the hospital with a diagnosis of cirrhosis has massive ascites and difficulty breathing. The nurse performs which intervention as a priority measure to assist the client with breathing? A. Reposition side to side every 2 hours. B. Elevates the head of the bed 60 degrees. C. Auscultates the lungs filled every 4 hours. D. Encourages deep breathing exercises every 2 hours. The answer is B. Elevates the head of the bed 60 degrees.
Hey, you've chosen your answer. Why did you choose
I
B?
second D.
Oh, okay. That was easier, right? Do you all
Yes.
agree with B?
Ah,
Yes, it's easier.
Okay.
yes,
Okay.
yes, yes. It's good.
Unless, unless maybe you have a question or you object to it, you can let us know. The answer is B. Yeah, that is true. So let us read the rationale quickly, then move on to the next question. Can I move on? Take the next question for us.
A client arrives at the emergency department with upper GI bleeding and is in moderate distress. The priority nursing action is to obtain vital signs. B. Ask the client about the precipitating event. C. Complete an abdominal physical assessment. D. Insert a nasogastric tube. Need to
Mm-hmm.
obtain vital signs.
A.
Are you sure?
Sure.
A.
Yes, please.
I'll go for
A.
C.
Yeah.
Someone says she'll go for B. What else?
C. I'll go for C.
Someone is also saying C. Anything else? Okay. Frank, sorry, Franklin, your network is not good. I nearly called you Franklin, right? Hmm. Okay. So those who chose A, why A?
Yes, sir.
Tell us briefly.
Yes, no.
Okay. Those who can help. Let us take this faster so that we can move on.
So I'm going for A because I think the priority assessment in nursing is obtaining vitals first. Okay. And so
Okay.
yeah. And then we also see that the client has some moderate distress, which
Mm.
has a problem of GI infection. So the nurse must determine the severity of the situation before any other thing.
Okay. Okay. And the one
And
who chose
also,
C.
yeah,
Uh-huh. You
Sir,
can
you
talk.
know, the vital signs will also give us the physiological happening of the body, since it is the basic, the baseline for knowing other happenings in the body. So the bleeding, once the person is bleeding, it will show in the BP, that is the blood pressure will go low. That means there is bleeding,
Okay.
and there will
Okay.
Yeah, sir.
be
And then I think um while we are looking at the C to be correct,
um,
even
I
though
think
it's important to
sorry, I think our
hello?
sister was talking, but her network has dimmed her voice as if she's not talking, but she's
Okay.
actually talking. But her network, okay, you can carry on. She's still breaking. You can carry on.
I was saying that whilst the abdominal assessment is very important, I think the vital signs will provide a more clearer like picture to whatever that is happening, the instability that is happening with
That
the
is true.
GI bleeding. Yeah.
Yes, that is true. That is true. Okay. So let us read the rationale. I hope we are learning something. Those of us who are choosing wrong answers in our minds and we don't want to own up. You are behind your screens. I've seen you, okay? And you know yourselves. Okay. Someone just said shit. I should have chosen this one. But no no problem. We have another question to go around. So let's see if you
Sir,
get this one correct.
sir,
Mhm.
please, may I know the answer for the other one?
Oh, you didn't see.
No, please, I stood up a
Okay.
little.
Have you
Was
seen it?
A, okay.
Yes. So it is vital signs, okay.
Okay, thank you.
You're welcome. So let's do this one quickly.
A
Who can
client
be
with a
here?
history of suicide attempts is admitted to the mental health unit with a diagnosis of depression. Upon arrival, the client therapist report to the nurse that the client telephoned the therapist earlier in the evening and reported having overwhelming suicidal thoughts. Keeping this information in mind, the priority of the nurse is to assess for A. Interaction with peers. B. The presence of suicidal thoughts. C. The amount of food intake for the past 24 hours. D. Information regarding the past medication regimen. Is B. The presence of suicidal thoughts.
This one too is easy.
B.
Yeah, it's B.
Mhm.
Clap for yourself if you choose a different answer. Okay, for this one, no one should get it wrong for this one. Remember what we discussed previously. Okay, the client already has history of suicide. So um one thing you should also note is that someone who has already attempted suicide before, no matter how many years ago, that person has a tendency to commit actual suicide again. Okay, and who knows whether around this time, the patient or the person might be able to carry out 100% effectively. So, anyone who has history of suicide can commit suicide again. So, if you have any other options trying to convince you to be the answer, remember we said survival, things that involve survival, they overcome everything. Even though the rest of the options are okay, they are correct, but you have to pick the one that is more appropriate, which in this case is B. Do we understand? Can we carry on? Who has a question on this? Okay. Let's take our next question.
A group of health nurses caring for a group of homeless people. When planning for the potential needs of
Oh,
this
sorry.
group, what
Mhm.
is, what is the most immediate concern? A. Peer support through structured groups. B. Finding affordable housing for the group. C. Setting up a 24-hour crisis center and hotline. D. Meeting the basic needs to ensure that adequate food, shelter, and clothing are available. The answer is D.
D,
Okay.
D.
according to Maslow's
Mhm.
hierarchy of needs.
According to Maslow's hierarchy of needs, right?
Yes.
Homeless people. Are you sure?
Yes, it's D.
I like the way you say
Yeah.
yes. There is nothing can shaking you, right? Yes, the
No
answer
He
is D.
sir.
added
D for dog.
Maslow's.
Yes, D for dog. You remember I've cited example on search questions before, right? So this is a similar one.
Yes, please.
If not, just imagine you before Enclaves. What I mean by you before Enclaves is when you had not started studying Enclaves. Should you have seen this question? Would you even think of selecting option D to be the answer? You have something like this, and you'll
No
be
sir.
thinking about it.
No, I will
So
select B or A safe.
good.
I've
So you see
selected B.
why other nurses say English is difficult. There is nothing difficult on this end. Just that you have to give it time and pass through the process. You know what it takes to become, I mean, a successful English passer. Okay, in a US certified nurse. So if you are here, it's like any other field which you are fighting to understand. You just have to pass through the process and everything will be fine. I hope you are liking it. Those of you who have gone far. I know those of you who have started not long ago, you are crying, but don't worry. Those who those who have gone far, you have to encourage those who just started, okay, and wipe their tears. Tell them that everything will be fine with time, okay? Okay. So yes, the answer
Yes,
is
Okay.
please. We need it. We need it.
yeah, everything will be fine. Very soon, I know some of you, especially newbies, are like, hey, so how did this person pick the answer? Hey, these people they are sharks, so no one is shark. They started somewhere even worse. If I should use the word worse, some of you, somewhere even worse than um those who have started. Okay, yes, and I know I was also one of the worst people when I started the English because we did it on our own, and you'll be challenging questions will be beating you. You would have to, do a lot of researches to know what the English wants. So it is through learning that you get to where you are. Like no one comes out fully matured all at once. Okay, you have to pass through a process then. So if you are here and you are struggling, just give it time. Do what you have to do, what we are telling you, and with time, you pick up a question and you'll be answering. It works like magic. Okay, you won't know until you get there. It is like when you pass the English too. That one too is like a magical feeling. I think that the feeling, the adjective to describe the feeling is the word magical. Okay, because you never. When someone tells you, you can't imagine until you pass through and you realize it that it's really magical. So, we wish ourselves the best, right? Can you read this one for us and let's see? I think we have two more questions to go.
A community health nurse is working with older residents who were involved in recent flood. Many of the residents are emotionally despondent and they refuse to leave their homes for days. When planning for rescue and relocation of these older residents, what is the first item that the nurse needs to consider? A. Contacting the older resident's family. B. Attending to the emotional needs of the older residents. C. Arranging for ambulance transportation for the oldest residents. D. Attending to the nutritional status and basic needs of the older residents. D.
You see, this one looks like the first one. I mean, the previous one we did.
Yes.
Yeah.
Is someone seeing what I'm seeing?
Yeah.
Yeah, the
Yeah. So
concept is the same. Yeah.
yes, yes.
Emotion.
So very similar concept. Okay. So that is the answer, and that is our quick rationale. You can go through it. I think we are left with only one last question. Okay. Let's take our last question and talk about something else.
You would be most concerned about an order for a total parenteral nutrition, fat emotion for a client with which condition? 1. Gastrointestinal obstruction. 2. Severe anorexia nervosa. 3. Chronic diarrhea and vomiting. 4. Fractured femur.
Mm-hmm.
Fractured femur.
Mm. Right. Can you explain? Oh, come on. Oh, if
Okay,
you think
I
it's a
think
different answer, you can also say it and tell us why you think it is so.
I think with the total parenteral nutrition, we are giving fat emotions. So and a patient with a fractured femur will further complicate this condition because there's possibility of embolism for a formation of embolus that can travel to the lung. So it will further exacerbate. Some of the fat may end up in the lungs with such a patient. That's
Okay. Thank you. Who else wants to try in a different way?
So I choose 4.
I didn't
Uh-huh. Right.
Fractured femur.
about
even think
Because
that way. Malnutrition.
that emotion
somebody
for
But
is
some
talking.
Who is
femur.
talking? I think
I don't
someone
know
is
why you.
breaking up. Can you come again? You were breaking up
Hello.
initially. Yes. You were breaking up
I was
initially.
saying that the 3 options. Okay, please be better now.
Yeah, I can hear you.
Okay. My answer is also 4, but I have a different rationale.
Okay. Let us hear you.
The first three the first 3 options are directly related to malnutrition, like the gastrointestinal obstruction, severe anorexia nervosa, chronic diarrhea and vomiting. You can relate them to malnutrition. So if you are giving this patient TPN, I will not be concerned about it. But someone with a fractured femur, like there is no indication that the patient cannot take any other kind of nutrition than this one. So that's my own rationale.
Okay, interesting. Okay. But is there anyone here who thinks it's a different answer aside for? Okay. Let us carry on because we. Uh-huh.
Please, can we consider 2?
So let us know your thoughts. Why do you think it's two? So that we can see if there's something for us to pick up from there. Oh yeah, I mean anything makes sense. You know, every option is a well calculated option, so there could be something enticing someone to pick two. So why do you think it's two?
I was just thinking, you see, those who suffer from anorexia nervosa,
Yeah.
I read in UL that you are not supposed to um like I don't know how to you're not supposed to when you are giving them the TPN, it should be the nutrients should be gradual. You shouldn't
Yeah.
overwhelm them with the nutrients.
Yeah. And that is
Yes,
100% correct. Yeah.
yes.
So that is
So
why you think it is two way.
yes, please.
Okay, so you see that you've drawn our attention to something to clarify. Okay, so let me start from your point before I jump on to four. First of all, when we say TPN, it's total parenteral nutrition. Anything parenteral means we are giving it to you IV. Okay, TPNs, most of them contains lots of fat. We have different, we can have different forms, okay, and with different composition, but mostly they are fat. So when there is a condition which prevents someone to take food through the GIT. So the GIT can mean whether you putting the food in your mouth to masticate it and make the food pass through your alimentary canal, I mean through the normal processes of digestion. Either through that part or through an NG tube, through a gastrostomy tube, jejunostomy tube. I mean, through whichever tube. If you are contraindicated, we have conditions where, I mean, we have to refrain from or we have to keep you MPO. And as part of recovery, especially if you have certain conditions, as part of recovery, feeding is part, even it's part of, like, I don't want to even go there. I wanted to mention something, but I don't want to even go there. But I mean, feeding, if you want to, in the critical care settings, feeding is part of the healing process. Okay, so you can't keep a patient there for a very long time without giving the person certain nutrients that he or she needs. So in this case, if there is something um, preventing us to give food through the alimentary canal, whether through any of the portal I mentioned, and the person should still receive nutrients, that is why we choose the IV route and we give the TPN. They've been prepared in a way to be absorbed via IV route. Okay, so this one is not going to the stomach. It's like medication, but it is food. That is what TPN means. All right. Remember, central lines, giving TPN via central lines are preferred other than peripheral lines. On the ankles, you have everything there. So it's not like elsewhere, like it on the ankles, like I said, or like we've been talking about already, you have, I mean, you have no excuse, you have no improvisation. This is strictly IV. Sorry, I said IV. It is strictly a central line. Okay, it is strictly a central line through which we can give TPN. So it's also one of those things you should take note. Now, this question to I don't want to talk about TPN into details, but just to let you understand for the benefit of those who just joined us, so that you understand it from your point to where we want to land. Now, this question is not telling you that the TPN is infused rapidly for you to associate it with what you are saying. Okay, it says you'll be most concerned about an order for TPN fat emulsion for a client with which condition. And in your words, you said when you are giving TPN to anorexia nervosa, you don't hasten it. You rather slow down, right? So you ask yourself, is this question talking about how fast or how slow we should give TPN, or how safe it is for one to get a TPN? Between the two, which one is the question talking about?
Sir, please, how safe it is?
How safe it is. Okay, so if you don't get the concept of the question first, you end up getting everything wrong. It is like you set your own question in your mind and you try to find an answer for it. And you see you had an answer too. You had a very nice answer, which was two. So that is how the NCLEX is. Okay. So always take the questions and you can you start practicing it with what you do. Okay. On your dashboard with your dashboard text. Try and take the question exactly as it is. Don't think for the question and don't set your own questions in your mind to answer questions. So this is based more on safe. When you look at option 1 to 3, so this is a side assignment. If you have time, you can look at it. We have indications of TPN, conditions in which you are that maybe a prescriber will prescribe TPN for you. Okay, so looking at option 1 to option 3, there are indications like when we can give TPN. So when someone has GI obstruction, okay, let's say the person has intestinal obstruction, nothing. When we say we are all nurses, we understand what it means, right? Gastrointestinal obstruction. It means anything that you eat, it can't pass through the normal routes and entry canal, then the end part coming out as what? Feces or maybe being digested. You can't have that happening because you have obstruction. We have different types of GI obstruction. Of volvulus, um, uh, we have lots of them, like plenty. Okay, uh, I can't mention all of them right now. So
Interception.
interception, it's also part. There are plenty things that.
Hirschsprung's disease.
Which one? Yeah, yes, Hirschsprung's disease. Yes, where you have the nerves,
Pyloric
the nerve.
stenosis.
Pyloric stenosis is also there. Okay, just below your stomach. Your stomach. There are a lot of them. So anything that causes GI, when someone has such conditions, even though the person can be 100% conscious, okay, but the person will be kept MPU because of what is happening. And this person has to get nutrients. What do we do? We give TPA to sustain the patient. So GI obstruction is part. Severe anorexia nervosa, like you said. We have to slow down. The person is having, it also is like a psychiatric condition. So we have its own ways of solving it. But as you are solving it, the person is getting emaciated. So we have to try and find a different way of getting nutrients into the patient. So that's where the IV route comes in, and hence TPN. Okay, but even when you are restarting, even when they are not even only IVs, okay, when you are even resuming food, like even if they later eat after everything and they are eating too, everything goes on slowly. Okay, it's like refeeding syndrome. It has something to do with, in a bit, it has something to do with refeeding syndrome. I know some of you, it's your first time of hearing something called refeeding syndrome. You can write it somewhere and read about it. It's in your notes anyway. If you've opened your eyes well, it's in your notes. Okay. So you are correct when you say that, sister, but it's rather an indication. And the question is interested in which one is safe. Okay. Option 3, when you have diarrhea and vomit, so it's like how do we call this condition? Irritable bowel syndrome. Those people who have very hyperactive bowel, anything that falls within the intestines, person will be running and will be losing a lot of fluid and electrolytes. So when you have certain conditions like that too, most healthcare providers would want to keep you MPO. Okay, then we treat whichever organism that is causing that. before we can clear you to it. So as we wait to clear the infection or whichever thing that is causing the problem, we give you TPN to help sustain some nutrients. Okay. So these are, even though you are talking about prioritization, but you see, we are borrowing a lot of knowledge from different sections here. So that makes it interesting. When you know a lot of information, it makes everything you do very simple and you're able to coordinate. Okay. Now look at the last option here, fractured humor. Sorry, fractured femur. So mostly long bones and larger bones, when they are fractured in the body, you are likely to have something we call fat embolism. Please, fat embolism, I think we all know embolism, right? Embolism is like if it's clot, like clot, let's say blood clots causing embolism, we know, okay, it's like a blood clot, or let's say a blood which has clotted and it is blocking some parts of your body, or it is clogging some artery or some vein or some vessel elsewhere. This one, what makes fat embolism difficult to fight is that you can't give anticoagulants because it is not blood. It's not a blood product. It is fat itself. Okay, it is fat itself which is causing a blockage to a vessel. So fat embolism is very serious. Always have it in mind that whenever you have, so whether the person had a traumatic injury, like let's say road traffic accident or something that involved a fracture, the person has high tendency, very, very high. I've seen some before, and I saw it in Ghana. Okay, yes, at the ICU, the person almost had it, but her daughter, and then, she was very fast, so she saw it. Some of us, we drew attention to her, and because of what was happening, she intervened. We all helped, and she was safe. It is very dangerous. Okay, so whenever you get questions and you see any long bone fracture, so it can be humerus. Humerus is your upper hand. The opposite of humerus, like compared to your leg, is the femur. So humerus is on your hand. If you know your bones very well. Okay, then femur. So either femur fracture, humerus fracture, um, pelvis, like fracture of the pelvis. Okay, you see that one too is a larger bone. So any bone that is very long or very, large in nature, they have higher risk of what's causing fat embolism. Remember, just surgery too. Okay, surgery, especially when you undergo let's say surgery like exploratory laparotomy, you are likely, or we can't rule you out of what fat embolism. So the thing is, what will even click your mind that this question is talking about fat embolism, unless you know your facts well. So you see, as soon as this question popped up, someone noticed that fat embolism could be an issue. All right. So with the little that we've talked about fat embolism, or the little that we've said about fat embolism, I know we've not gone into details, but at least for all that I've said, and please, the fat is coming from those of you who are thinking about where the fat is coming from your bones. Okay, is it from the bones or from edges of the bones fracturing, or let's say maybe exposing fatty tissues? Which part? Is it from the bone itself or
The bone marrow.
fatty tissues? the bone marrow. Okay.
Yes,
Yes.
but
Yes. So the bone marrow has some fats in there, which can cause that. And with regards to surgery too, someone will say when like exploration laparotomy I mentioned, you don't cut any bone. So how about that one? You know, when you cut through the skin, you meet a layer of fat, right? Yes. So those some of those tiny fats can get anywhere. So that is also one risk factor. Okay. So that is fat embolism. How? Let me say this about it before another thing. Okay, about it before we come back to the question and finalize it. When one has fat embolism, how will you see it on the skin? There is one indication that everybody here should know. If, like I always say, there are some things if you're part of USRN elites, you should know. It should be part of your anthem. Fat embolism, how can you recognize it on the body? Should someone have it?
I think there is
Yeah.
petechial rash on the chest.
Good. So when you see either ecchymosis or petechia, most of the times you see petechia. There are all signs of bleeding, okay, like some dot reddish um discoloration, okay, under the skin. Most of the times around your chest area. Okay, no one, I don't know how I mean, that normally happens around the chest. I can't tell you why, but that is one key spot. So whenever you are solving a question and it says the person undergone a major surgery, okay, or the person had a fracture, an accident and maybe fracture happened or occurred, and they later tell you maybe the patient is showing signs of fat embolism. Which of the following is an indication? And you see petechia around the chest, that is your answer. Okay. And they can say it in different way that the person had maybe road traffic accident and fractured maybe the femur or the pelvis. Okay. The person is now showing signs of bleed or signs of petechia can be found, or let's say spots of bleed can be found around the patient's chest. What is likely to be the condition happening in the patient? Then you know that that is also fat embolism. So that is one way. So they can ask it in any way or any form they want. But the thing is, if you know the answer, you know. If you don't know, you don't know. Okay. All right. So 1, 2, 3, according to what we have here, they are all indications. We rather give them when you have these conditions. You rather give TPN to help. Okay. But when you give TPN to someone who has a femur fracture, the femur getting a femur fracture, okay, fracture of any long bone itself is a risk factor for getting fat embolism. And if someone who already has the tendency of getting fat embolism, just imagine you going to add more fat. And TPN is not through the mouth, it's not through an NG tube. Like I said, it's through IV. So the person is already having this within the veins or whichever, whether artery or vein. Will you push more fat into the veins of these patients? You complicate the fat, okay? So it will make fat embolism worse, okay? And whatever thing that you give IV, some get into the bones. You know that whatever medication, because blood flows through everywhere and blood flows into the bones too. So when you give TPN, it goes through it goes through your veins, then it gets into the bones too. So if you have a fractured bone, you add up a lot of fat and you give it more chance to form what fat embolism. Are we there?
yes, please.
So that is the reason. Okay, that is the reason. Any question? No? So we all agree that the answer is 4, right? At this point, we all agree, don't we?
Yes, please.
Okay. So that brings us to an end of to the end of prioritization. We have something else to talk about under fundamentals: modified radical mastectomy. So let us talk about this one quickly. So we're going to talk about most of the things that we can talk about. We look at areas that the NCLEX is interested on, like how we are discussing things. Then you take notes so that you can apply them. Okay. Now, when we talk about, please, anyone with any question before we start this one? So, when we talk about mastectomy, mastectomy is removing what? Mastitis is what?
Breast inflammation of the
Breast.
breast.
Okay, so mastectomy is removal of what?
Removal of the breast,
All
affected
of
breast.
the. Okay, good. So that is it. So it could be due to maybe cancer or whichever. Maybe it could be a node that is maybe becoming cancerous or that has become cancerous. Okay, that will, or whichever cause it might be. At the end of the day, what will happen is that you will have to remove or um excise. Should we say excise? Our surgeons here, our nurses who work um in the theater. How do we say it? But it will end up removing your breast. Okay, that part which has that problem. So when okay, let us look at what we have here. Then after, if there's anything that I can think about, I'll add up. Now, when we talk about this process, what happens is that with modified radical mastectomy, what happens is that we remove the breast tissues, okay, the axillary nodes. You have lymph nodes in your armpit. You know that. The breast has parts of it. Let me say some of the tissues are closer, or let me say they enter your axillary parts, something like that. I hope you know, right? Some of the tissues are connected to the muscles, or let me say to your armpits. Okay, right outside. So when you have, if I'm lying to you, you can tell me. I don't have. Sorry, I don't have your breast. Okay.
You are not lying, please.
Uh-huh. I wanted you to talk. Maybe I'm lying about that part. So the when we talk about this modified radical one, it means you are removing the breast, the axillary nose. That's the nose within your armpit, because axilla is armpit. Then we are also removing what? Superior apical nodes. So we have some nose too on top of your chest, on top of the breast, okay? But muscles are preserved. So for aesthetic purposes, okay, or we don't want to deform you plenty. So we will remove all those things under which are causing issues so that we can maintain some muscles as much as possible. Okay, because cancer cells, if you don't cure them or you don't remove them, they metastasize. And when metastasis occur, it makes it worse, it makes your whole body worse. And at the end of the day, you know where you land. Okay. So most of the times, this is what they do in modified radical mastectomy. But what are we supposed to do? The removal of all these things is not our concern. Okay, but at least we must know what happens in there so that you can appreciate and you know how to manage. So before you can appreciate this, let me let me see if I can tell you something small about lymphatic system. If you understand lymphatic system, it will make this one very interesting, and I mean it will make it very interesting to you, and you're going to appreciate it. You know that the lymphatic system has its own vessels and all of that. So it's like you have your normal arteries, veins, and capillaries as part of the circulatory system. As the circulatory system supplies blood to all vital organs and tissues of the body, what happens is that they leave out some fluids within the tissues. Okay, so it is now the duty or the function of the lymphatic system. So that's what the lymphatic system does, to mop up all those fluids which are left by the circulatory system within the tissues and all over, then gather them as what? Lymph. A lot of things mix up. Okay. Then that fluid that finally collects, we call it lymph. Lymph, lymph. Then they flow through lymphatic vessels. Then they will be poured back into the circulatory system. My mouth is dry. Sorry. Okay. So that's basically the function of the lymphatic system. Okay, whenever circulation, when you read more, you appreciate, you see, you understand that this is how you can understand it. Very simple. Whenever circulation happens, some fluids are left up. Okay, they are left within body tissues and lots of places. It's the function of the lymphatic system to mop up all those fluids and gather them and pour them back into the circulatory system. Then it's like a cycle, it continues. But we have some vital points or joints within the body where you have lymph nodes, okay, and you have lymph. So it's like let me see if I can draw something here so that you can appreciate what we are saying. Please, I'm just making a sketch, okay? This is someone's hand. I'm using your hand as an example. Okay, so let me make it this way so that you understand. So this is your elbow, okay? This is your inner arm. Then this is your hand. Let us take it this way so that you can appreciate it. Blood flows to all parts of our body. So circulation will leave out some tiny, tiny, tiny should I say droplet of water or some fluid there. I think fluid is more better, or it's better when I use it in this illustration. So it's the function of the lymphatic system to gather all these fluids within the tissues and send them back into the circulatory system. So they also have vessels. We have lymphatic vessels too, of which the fluid collected flow through. The fluid collected, we call it lymph. Okay. When the fluids are collected, we call it, they mix up with a lot of things. So um they can mix up with viruses within the tissues if maybe there's an infection elsewhere. So you have a lot of things mixing it up. So we have lymph nodes as part of the lymphatic system at vantage point. So we have one at your inner arm here. Okay. If you take your leg as an example, or your whole leg, your popliteal area. I hope you know your popliteal, the back of your knee. There's also a lymph node over there. So it is like this one, if you should use your leg as an example. So what happens is that when the lymphatic system is pulling the leftover fluids back into the circulatory system, We have lymph nodes as at vantage points, which filter the fluids coming. And if there are microorganisms in there, it will catch it up. Okay, and strain the lymph so that you are safe and it protects you, okay, from getting unnecessary infections. So that's what the lymph nodes also do. They filter lymphs. Okay. But when they become overwhelmed, they also have their issues. That is why, who has had this before? Especially when we were kids, when you get an infected wound on your leg, you have your groin area becoming swollen. Who has experience?
Yeah, that's very true.
Yes.
Even as
Yes. So we
adults,
have good, even adults, yes. So we have lymph nodes too at your groin areas. So you can imagine if, or let's say, had it not been these lymph nodes, which normally, so you see, let me give you an example with what I just said. When you get an infected wound on your leg, remember the infection is, I mean, it affects every part of your, I mean, the small vessels around that infected area, and you have some of those left out fluid there. So they'll be collected into the vessels, the lymphatic vessels, and they'll be carried into the circulatory system. So, as part of the function of the lymph nodes to filter the lymph, they filter the lymph coming from that part of the leg, and they become overwhelmed because the rate of the bacteria or whichever infections come in, I mean, it's too much for it. Then it will become overwhelmed and it will become inflamed and swollen. So had it not been that lymph node, it would have left you with what? A systemic infection, which would be more serious. So that's how lymph nodes protect the body. Okay. And linking this, if you understand what I've just said, and I think we've seen practical example, linking this with what we are trying to describe here, mastectomy, okay, modified radical mastectomy. Remember, you have some of these lymph nodes in your armpits. So someone who has undergone this procedure, what it means is that we have removed that protection from that arm. Are you getting the point? So that when later we mention some things, you appreciate what is happening, why it is so. So when we remove the lymph nodes, it means we've removed that protection that held that arm. Okay. So we are saying complications of this. Look at the second bulletin point here. Complication of this is lymphedema. Okay. Lymphedema means you can be, I mean, um you have edema which is caused by lymph. Okay. Yeah, lymphedema, it means your hand can be swollen because the leftover fluids have lost one important thing that helps what to pull it up and strain it. So your hand can be swollen, and when you have your hand swollen because a lymph node has been taken, that is what we call what lymphedema, because you have a lot of lymph in that arm and that cannot be, so you have edema of that hand. And we are saying um when you want to prevent this complication, what you have to do is that when you are caring for patients like this, you have to raise the hand or position the arm in such a way that the distal part is higher. Okay, the distal part is higher than the proximal part. Do you understand what that means? So when you have, look at the arm that I've drawn. So this, we are talking about anatomical positions. Look at the arm that I've drawn here. Distal means distance. So let's say this is your whole body. Okay, this is your whole body. This is your whole body. Then you have your hand here. So because this one is distancing itself from the body. I mean, this part. So we say this part is distal to maybe your elbow. Okay. And in this case, your elbow is in proximity. It's close to the body. So we say your elbow is proximal to maybe your hand, like anything that with which it is being compared with. Okay. So in this case, comparing the elbow and the hand is distal to your body, and this one is what proximal to the body, to the elbow. So what we are saying is that to prevent lymphedema, you have to lift your distal part to be higher above your heart level. Okay, so that means that you have to raise the hand so that, let's say, if your heart position is somewhere here, your hand should be something like this, resting on a lot of pillows, so that you can have lymph draining by what? Gravity into your main body or into your trunk. Do you appreciate it? Do you understand what we are saying? Okay.
Yes.
If you are following, you'll understand. Okay. So, what else do we have here? We are saying place client, the third point here, we are saying place client in semi-fowler's position. So that's also one position that you should know. Those of you who have been with us for a very long time, you know sometimes the ankle switches to positions. You know, you've seen a lot of people talking about that before, right? So positions for certain procedures, and after certain procedures, the positions you must assume and all of that. So semi-fowlers is preferred so that you elevate the the hand on a lot of pillows. So I've seen a question which says elevate the hand on a pillow against on lot of pillows. So the question was very specific about how high the hand should be raised. So when you see question that say on just a pillow, please look at the other options and see if there's any option that will end up raising the hand above the heart level. Go in for that answer and leave just a pillow. Okay. I've seen a question on that before. I think it's just clicked my mind. I've seen a question on it before. So always remember that the clue is you have to raise your hand in such a way that the distal part is up above the heart level so that it can drain. So when you get option, I'm repeating myself. If you get options like put your hand on a pillow, take your time. Don't choose that one as your answer yet. Look at the rest of the options. Maybe there will be a particular option that is telling you to even raise that arm more higher than just a pillow. Go in for that one instead of just a pillow. Okay. All right. Then what we are also so I mean the reason for that is to help promote dreaming. So the reason or one big thing that you should know, you see I'm holding it here. No blood works, please. Blood works means blood works. No blood works on that affected arm. Okay, no blood works. Make sure you don't give anything like whether subcut, IM, IV. Don't check blood pressure on that arm. Leave that arm to rest alone. If you check blood pressure, you worsen lymphedema. So that arm, we don't touch it. Any question on that? Any question on that? So when you see a question which says the person has gone for maybe left mastectomy, the person you should know that the person has what left arm precautions. In that case, that's what we say. And on the word you will see there will be a poster just before you enter the patient's room that left arm precaution. It will be there. Okay. And sometimes they are even in multiple, I mean, they are placed in multiple places, right over there, then on the patient's bed too, so that you will have no excuse that you didn't see. And I've happened to nurse patients on these things, I mean, with these conditions before. That's how it is. You see it written boldly, like right arm precaution or maybe left arm precaution. Okay. Um, General mastectomy, what else do you have to also look out for? Remember we said no blood works or no blood draw, no injections, no BP measurements. Okay. What else? And most of the times we after surgery they give them JP drinks. Those who don't know JP, it means Jackson Pratt. Okay, you can just browse and see what it is. Jackson Pratt. You squeeze it. You don't squeeze it tight, okay? You squeeze it. It helps to drain whichever fluid that is left in there at the surgical site. Okay. Then just to add that, please,
I'm
whenever
sorry, boss. What's
yes,
the name of that thing you just mentioned?
JP, Jackson Pratt.
Okay.
Yeah, Jackson Pratt. Okay, let me see. Let me see. Let me see.
Oh, it's
Okay,
pretty
so
round.
we have other things too we can use like Emovac. Okay, let me see if I can show you. Let me clear my screen right now. The written JP drain. It's okay, it's the same thing, Jackson Pratt drain. So this is how it is. Look at how it is. You see how it is over here. So it's like a bulb. Okay, we use for a lot of things, whether abdominal surgeries, like sometimes some surgeons, I mean neurosurgeons will even use it for drainage of maybe some hematoma or something. I mean depending on the surgeon's choice. Okay, so that's how it is like. So what you do is you squeeze. It's like a balloon. Okay, you squeeze. So this is like a real life one. You squeeze the middle, then it will produce a suction. Okay, like how you use a bulb, a suction bulb to suction case. So you press on it, and that pressure will gradually pull whichever fluid um that is at where this tip is inserted. Okay, it will put the fluid into the container. Then when it is full, you we have a way of disconnecting it. Okay, some has you see a stopper. They have a stop. You you click, you stop it. Okay, you make sure you block it. Then you can empty it. You can pour. See, it has another outlet here. You open it and you pour it in whichever container you're using to drain. Then after you leave this one open whilst you squeeze this one. Okay, with your right, I mean whichever arm you are using, but just one hand. You don't squeeze it like you are squeezing a cloth to dry. Okay. With just one hand. It's like your thumb and the rest of the fingers. Just squeeze it. Then with the squeeze, you don't release it. You close that opening. Okay, where you poured the content for. You close it so that you have that suction or that traction inside. which will try and pull whichever fluid that it has to pull. So that's how it works. Some people to use hemovac. Hemovac is like um that one is more intense, like a device. They even set pressures in that one is a machine. Okay, it's not like a simple device like this. Let me show you what hemovac is. So you see how hemovac is. So they put this one there, and sometimes they connect it to a machine. I think maybe we have different types of hemovac. This one looks like a pressure thing too. Okay, but we have some that you connect it to a machine. Yeah. So now what they do is that they are used to collect fluids collected at certain places of the body. So take note, no IV on that arm. What else can we talk about before we carry on? You make sure that right after surgery, you check for your ABC. It's very simple. You know about that already. Then, within the first 24 to 48 hours, please, when you see serosanguinous fluid, it is normal. Okay, in that drainage thing. Serosanguinous, when we say serosanguinous, sanguinous means bloody, right? Serosanguinous means you have the fluid, but you have blood in it. So it's like not only pure blood, you have blood and like other fluids also parts. You know how that one appears after surgery. Yeah. So sanguinous is pure blood. You don't have to see you should see something like serosanguinous. So it is normal. Should you see that? Don't think the person is bleeding. But after 48 hours, if but at the initial point you have blood coming out, but it shouldn't take more than and you should from time to time you should see the blood clearing from sanguinous to serosanguinous. Okay. Then with time it will clear to maybe very normal serous fluid. Then, like finally, the fluid should go away. That is how the normal healing process is. Okay, but after 48 hours, if you see bleeding or if you see any blood, like sanguinous fluid, which is bloody fluid, report it because for more than 48 hours, it is an issue. Okay, within the first 24 to 48 hours, still monitor. It is not an issue. So take note. And what else can we talk about? Yeah, so when you undergo this procedure too, I think this reminds me, you don't wear clothes that tightens you. Okay, or jewelry that uh, tightens your body. You have to wear very, very free clothing and jewelries. Okay. Sometimes even jewelries are not even encouraged. Sometimes. Whenever um you see swelling, heaviness, or tightness around that area, you have to report and all of that. We know signs of the infections, right? I'm sorry, you know the signs of infections. Any of them, you have to make sure you report. I think that is what we can say about this. I don't know. Is there any question on it or someone who wants to add something?
Please, concerning
Yes.
the drain,
Mhm.
is it possible that there can be blood clots so that in case of the blood clots, can you milk the tube so that I can dislodge the blood clot inside so that there can be free flowing of the drainage? Please you hear my question.
Your line was breaking in a way, but let me see if I understand what you want to ask. Are you asking about the possibility of the drain
Oh,
being
okay.
blocked
My
by
question is
blood clots and irrigating it. Is that your question?
Yes, or maybe milking the tube.
Okay. So they will tell you like whichever procedure. I will not limit. Remember that Jackson Pratt and all these things, they are not only using mastectomy, there are a lot of procedures. But please, depending on wherever it's being used, I would say just get a prescription before you do anything to it. Even on the ankles. They use them even in neurology, and you can't mess with someone's um, brain, when you have this thing connected to a space in the cranium. You can't, so you always need a prescription. Sometimes the surgeons will even do it themselves. So this is not a straight thing that the NCLEX will ask you that um, maybe the NCLEX can ask you, should you, well, I don't know how it can be asked in this case, but always be guided that you can't do it without a prescription. So if you have that in mind, no matter how maybe they ask you around it, you know what to do. I don't know if it helps your question. Are you there? Or his network has taken him away. But the rest of you, can you hear me?
Yes, please, we can hear you.
Yes,
Okay.
yes.
All right. So yes, so I think that is all. If you have any question, you can ask. Okay. Let me ask you a question. Please listen to this one. I don't have the question on the um on the screen, but listen to this and answer me if you can. Which action by the nurse indicates a need for immediate intervention? Which action by the nurse indicates a need for immediate intervention? Let's say nurse is caring for patient who has undergone mastectomy. Which action by the nurse indicates a need for immediate intervention? So the first one, like let's say applying deodorant to the affected arm. B, elevating the affected arm on a pillow. C, performing gentle hand grip exercise. D, assessing capillary refill in the affected arm. Which one do we think is the answer?
One,
Answer is E.
So it's
A,
A.
applying
applying
deodorant.
deodorant. Yes, so you shouldn't apply deodorant. Okay. Yes, or anything that can be harmful. All right. Um.
So I have a question.
Okay.
You said we shouldn't lift the affected arm,
I said what?
or okay, in your options, you said the client lifts the affected arm on a pillow,
Yes.
but the client is not meant to lift the affected arm on the pillow, right? It's meant
Why?
to be the unaffected arm.
Why do you think we shouldn't lift? Wait. Oh, did you hear what we all that we said? All that we talked about. Let me
Yes,
clarify.
sir.
Let me clarify this.
See, see, see
Let me
now.
clarify this. You
Bye
can
bye.
mute up. I think your background is noisy.
Okay, sir.
So listen to me in full, not in part. If you listen to me in part, like I don't know, maybe if it's network that disturbs you and you listen to parts and you go away, you take wrong information away. This goes to everybody, okay? So what I'm saying is that you can get questions. I think that was the part that you were trying to say. You can get questions that can say elevate your hand on a pillow. And I told you I've even seen a question like that before. When you see elevate your hand on a pillow, wait, don't choose that answer. Look at the rest of the options and see if there's any options, or if there's any option, sorry, if there's any option that encourages you to raise your hand up above more than just a pillow. That could be your answer. So that was what I said. I didn't say raising your hand
Please,
or
you was breaking on my side. Can you take that again?
okay. So what we are saying, you remember I drew the hand and everything, and you understand what is happening. So if you understand what is happening per all the explanations I gave, you know what to expect. The thing is, you don't want the hand to become swollen because of lymphedema. So it is like, you can't raise up your hand like hands up position forever. So as you lie in your semi-fowler's position, which is the recommended one, you want to elevate your hand as high as possible. As I said it that if you have an option that says elevate your hands on a pillow, it could be a trap. Don't rush and pick that as your answer. This is just an advice. Some of you might even say it when like if I choose not to even say this, some of you might even recognize it. Should we get it in the question? But for some of us who may rush and pick that as an answer, what I'm saying is that take your time because you've heard of it before. Don't let it be like, yes, I've heard of this before, so let me just go in for it. So you have to pause and look out for the rest of the options, whether there is something that, so you see, you can have an option like raise your hands on several pillows. Raise your hand on a pillow and raise your hand on several pillows. They are two different things. Okay, so at the end of the day, the thing is we want to keep your hand up above your heart level so that your hand can drain. Okay, it can drain lymph. I mean, yes, can drain lymph into your central part of your body. So when you see lift your hand on a pillow, take your time. Maybe there might be an option that is better than that. Okay, it doesn't mean that lift your hand on the pillow is wrong. Please, are you getting the concept? What I'm trying to say?
So, sir, which one
Yes,
is the
sir.
right? Several pillow or on a pillow?
So when you get several pillow, like I want you to I don't want you to just like think of it. You see how I'm treating. I can just say it and go away. I mean, so that we go away. But the thing is, I want you to understand the concept so that you cannot be tricked. So look at the question I asked. Okay, between what answers did I even say? I said uh what was even the question that I
Applying the deadline.
yes. So the question is
Yeah.
the deodorant part, right? I said which, let's say a nurse, you're a nurse, you're caring for a patient with who has undergone mastectomy. So which action by the nurse would indicate a need for immediate intervention? That was what I asked. And the first one I said applying deodorant to the affected arm. Okay. And the second one I said elevating the affected arm on a pillow. I said on a pillow. The third one I said performing gentle hand grip exercise. Remember the question is looking for a bad thing. Will indicate immediate intervention. It means we are looking for a bad thing. Okay. So option C, I said performing gentle hand grip exercise. And option D, I said assessing capillary refill in the affected arm. So among these options that you have, which one do you think would be the bad one to choose? You can't choose elevating the affected arm on a pillow as the bad one compared to applying deodorant to the affected arm. Do you get what I'm trying to say? But let's say among these options,
Yes.
should you have elevating the affected arm on a pillow as one option, and the next option, elevating the affected arm on several pillows? Between the two, which one would be your better answer?
Several pillows.
So
Several
that is
pillows.
the concept I'm trying to cite here. Do you understand what I'm trying to say? Because at the end of the day, it is several pillows that will make your hand go higher and the drainage will be effective than just a pillow. Do you understand what I'm trying to say?
Yes, yes.
Yeah, so with everything you get, compare with the options you have. Okay, compare with the options that have been given to you and choose your best answer. I hope I've been able to clear myself. We all understand it, right?
Yes, please.
Okay. I wanted to ask another question. Okay, so let us look at this question to analyze it. A client says, I don't feel like a woman anymore. Okay, after this client undergoes mastectomy, or you're caring for a client who undergoes mastectomy, the client tells you, I don't feel like a woman anymore. What would be your best response? This sounds like therapeutic communication. So the first one is you should focus on the recovery right now. Okay, so I'm asking, what is the best response to give to the nurse, to the patient? So the first one is you should focus on recovery right now. Option two, many women feel this way after surgery. Option C, your family still loves you the same. Nothing has changed, okay? Option D, you can discuss reconstruction options later. Which one do you think is the best?
Sir, please, my line
Option
went
D
off.
again. Option D again.
You are caring for a client who undergone mastectomy, and the client said, I don't feel like a woman anymore. So what will be your best response as a nurse? So the option A says you should focus on your recovery right now. Option B says many women feel this way after surgery. Option C says your family still loves you the same. Okay, nothing has changed. Option D says you can discuss reconstruction options later. Which one is the answer?
I'll pick B.
You can discuss reconstruction options later.
Yeah. Yes.
Okay. I know some people are waiting for the answer, then after they will say, yes, I said it. If you if you said it, say it right now so that we can hear you. Okay. All right. So only D. People are choosing D. Okay, so the answer is B, not D. B for boy. One thing about and please don't apply it only to mastectomy. Generally, therapeutic communications. When someone tells you, look at let's use this one as an example. I don't feel like a woman anymore. Your response should reflect on the person's feeling and what the person is saying. Because when you tell the person you can discuss reconstruction options, it means you've endorsed the patient. Like it's like you are saying what the patient is saying is true. Okay, it's like you are endorsing the idea that the woman has that. Of course, she's not a woman, and for that matter, you are giving her let's say another choice that can change the way that she is. You understand what I'm trying to say? So as a nurse,
Option B again. Option B.
As a nurse, what you have to say is, in this case, option B says many women feel this way after surgery. It is a nice way to start. Okay, so this one, you are reflecting on the woman's feeling. Okay, which is not judgmental because you are letting the woman know that it's a general feeling everybody feels. Okay, so many women feel this way after surgery. When you choose option A, like you should focus on recovery right now, it's like you are shunning what the woman is saying. You don't do that. Option C says your family still loves you the same. The woman is saying, I feel like um I'm not a woman anymore. What does it have to do with your family loving me? I mean, my family loving me. You get it?
Patrol,
So that one too doesn't reflect on what the patient is
Patrol
saying.
now, sir.
See, the person will come and ask again, what did you say?
Hello, sir.
It's
Sir.
interesting.
Hello.
Yes, I'm
Is
going.
it? Yeah. Is it like? Isn't quite answer B? Trying to generalize her feelings
It's
with
say.
other,
Yes.
because actually
Mhm.
nursing is about equality of man. You understand? So I think that maybe treating every person's problem as an individual.
Okay, do you know something? In order to save
Yeah.
time, I'll post these questions on the page so that we can talk about them. But it's good we are discussing it here anyway. I wish I was able to put them over here for us to discuss. But yeah, so when you get therapeutic communication, we shall have time to treat them. Okay, maybe if I get chance, I'll pull a lot of them in one of our upcoming classes. Then we will play with them. Please, I've done this before. There was a time we played with lots of therapeutic communication, and around that batch, not even a single person could be trained with therapeutic communication questions. There will be a time, not long from now, I'll try and see if we can put that up and do it again. Okay, but the answer is B in this case. All right, I think what we have to know regarding the case on this one is what I've shared. Let's look at, I think there's something to
Sir,
connect it with here.
sir,
Yes, yes, sister.
please, concerning the first question, is it that all the answers are not, they all wrong, but the worst one is the deodorant, right?
Yes, so the question was, you are caring for a, what's the question? Like you are caring
I
for a
no, the,
patient
the
who has
answer
undergone.
provided, the answers wasn't, they were
Yes,
not, they were all not correct, but the worst one was the deodorant.
no.
No.
So that is why I'm starting from the question.
Okay.
From the question, you will know what it is. If you don't pay attention to the question, you can deviate the whole thing and get it wrong.
Yeah.
So the question says you are caring for a patient who has undergone mastectomy. So
Uh-huh.
which action by the nurse indicates a need for further intervention? So it means there will be one answer which is wrong, but the rest are correct.
The
When
rest
you
is
get questions like this, that's what it means.
but said the one that requested for exercise also,
Yes, so
was
let me
that?
talk about that. Yes. So let me talk about that. So the first option was applying deodorant to the affected arm. We all agree that that is very wrong.
Mm-hmm.
And elevating the arm on the pillow, that is fine, that is correct.
Yeah.
Then the option C was performing gentle hand grip exercise. So we have something we call isometric exercise. You can write it somewhere and look at them. Okay. It is not
Okay.
exercise that aggravates you. It's like they increase it says like they squeeze your arms, they improve blood flow and even with such exercises, in case of lymphedema, it will help to drain the fluid in the tissues. So it is like who are seeing that thing that I don't know the name. Those who normally do exercises here, I think you know. It has a very, should I say, it feels like something like a hard plier, but not a plier. That's something that you squeeze. Okay, you use your one hand to squeeze. Sometimes it's even a ball that you
Yeah,
can
people
squeeze.
who have CVAs.
Good.
Yeah.
Yes. Those things. Okay, that's the squeeze or the press. Okay, you have to use some extensive force. So as you squeeze that thing, remember it increases the tension in your arm. So those are the exercises which are good. They are gentle, and they are also, sometimes you see something like isometric exercises. Those are fine. And we have some that maybe you can do range of motion. There are some cases you can't even do range of motion, only isometric. Okay, so in lymphedema, or to prevent lymphedema, performing gentle hand grip exercise is recommended. Please, do you understand? The one who has the question.
Yes, please.
Okay. All right. Now let us quickly talk about what we have on our slide here. How to identify or notice breast cancer symptoms. The first one is swelling or thickening of the breast. So when you see this, please, it's a symptom. It doesn't mean you have, okay, but it's like a risk factor or something for you not to take it lightly. If you see dimpling of the breast skin, nipple crust, redness or heat of breast skin, you see some parts, it will be hotter than the other parts, okay? It should be an issue. New nipple discharge, that is not breast milk, including blood. So one trick per what I've seen with cancers, okay, is that most of the time I mean, you see bleeding. Just look at cervical cancer, okay? Just look at colorectal cancer. So you see how sometimes cancers are. You sometimes you not even have pain. Most of the times you just, I mean, the blood will be coming without even any pain. Sometimes, okay. So when you have those discharges and they are mainly blood, please don't sit there. Okay, it could be something dangerous. Then skin sores. Okay, when you have skin sores on the breast, bumps. When you have abnormal bumps, which they are new, it's not supposed to be there. Don't take it lightly. Growing visible veins on the breast. You will see that the veins are becoming larger than normal, not your normal veins. Don't take it lightly. Then sunken nipple. That one too is another thing. Then changes in the size or shape of the breast. Your breast is not like that, but you see abnormal. You see it. I mean, changing into an abnormal size or abnormal shape. Okay. Yes. So that is it. Then the next thing to also talk about is orange peel skin. Do you know what we mean by orange peel skin? The first time when I was learning English, I never understood this until it got to a certain point in time before. So when you peel an orange, you see the peel has some dot on that uh, peel that you remove. This person talking will come and ask the question. This person talking, you see.
What's up? Oh?
Yo, let's continue. Orange peel skin. Okay, when you peel an orange, that dot thing on that peel. Sometimes you see those of you who, I think, by all means, I know we have past nurses here who are in different specialties. I know we have someone who has worked or who is even still working with such units here before. or whether you've worked with them before or you are still working there, you are here. You know yourself. I got to realize, you see, we are getting to 4 years since USRN really started. Okay, almost 4 years, few months to 4 years. Yes, just few, almost 4 years. Ever since we started, I haven't seen anyone like in any specialty area we haven't had. So I know in our midst we have senior men and senior women here, but they tend to hide themselves. Anyone who can try to explain to us, or we all understand how it feels like or how it looks like. Orange peel, I don't know, I wish I can show you a picture here.
Hello.
But you see, yes, you see we have one here.
So you said you want me to describe the pod orange.
Yes. Okay. So yes, that's another name for it, right?
Yes.
How do you can you say it again, please?
Pod orange.
Okay.
All right.
All
So if you know how the orange peel looks like, that is how it is. So it is hardened a bit. The skin around the breast skin becomes a bit hard, and then you see that it has this like it has some small holes. So
Holes.
yes, so like it has. I don't even know how to describe. If you know how the orange skin looks like, that is how it is.
Hello.
Okay. Yes.
Sometimes
Yes.
when you have
Awesome.
a boil that is matured, or but like sometimes part of the boil around the skin, you will see that thing around it. When you see a
Yes.
boil that has a
Yes.
patch
Yes.
and it's
Yes.
hard, looks sometimes
Okay.
it looks like that. You see like some orange peel skin like that. The the
Okay.
Uh-huh.
skin, the hair follicles will become enlarged and red.
Yes, that is what
Okay.
I was trying to say. And then sometimes that is where you get the inverted nipple.
Okay.
Yes.
Okay.
Uh-huh. So that's when you get the nipple will also become inverted. Yeah,
Okay.
so
Thank you very
thank
much.
you.
So we appreciate
Welcome.
it more even when our specialty nurses come in with their experiences. So you see, all right. Thank you for your contribution. Much appreciated. So the last one here is hard lump in the breast. So that one too could be a breast cancer symptom. I want us to solve some few questions on these things, okay, over here before we go, before we close today. And before we close, I'll ask my questions, okay. Someone should read the first question for us.
The nurse evaluate teaching provided to a group community members on breast cancer awareness. Which statement indicates that teaching on risk factors has been effective? Select all that apply. 1. Not breastfeeding increases the risk of breast cancer. 2. Having children after age 30 increases the risk of breast cancer. 3. Having previous irradiation Having previous radiation of the chest increases the risk of breast cancer. 4. Experiencing menopause after age 50 increases the risk of breast cancer. 5. Having a first or second degree relative with breast cancer increases the risk of breast cancer. 6. Having harmful mutations in BRCA1 or BRCA2 suppression increases the risk of breast cancer.
Okay. Because this one is like select or that apply questions, let us do it together in order to save time. The first one, let us choose together. Do we think the first option is part? Not breastfeeding increases risk of breast cancer. Is it true?
Not true.
Some are saying true, some are saying not true.
It's true.
So what are we looking for? Are we looking
It's
for
not
causes or risk?
It's true.
It's true.
I say
It's true.
Um,
so. We are not saying when you breastfeed, you definitely get. Sorry, when you don't breastfeed, you definitely get breast cancer. Okay, so let us look at it well. What about the option two? Having children after age 30
Please, is it
increases.
established that one is true or not true? Before we move on.
Oh, no, I want to hear what you want to say.
Okay, me, I think it's true
Yes,
because
we
it
are doing
says
it together. Oh.
increases. It
We are
says
doing it
increases,
together. So,
not
uh-huh.
definite. Like it
Yes, not
increases your
definitely.
time, but it
Yes,
doesn't mean that definitely. If not, if you don't breastfeed, you wouldn't get it. But it means that it will increase your risk. You
yes,
understand? But it doesn't
yes.
mean that
That's
you
what you are
will
saying.
get it. So I think it's pass.
Okay.
Bacha medasi.
Yo, yo. Let us continue. Okay. Hmm. It is what it is. Um, Option two: having children after age 30 increases the risk of breast cancer. Is it true?
Not
Not
true.
Not
Not
true.
true.
Not true.
So this
Not
is
true.
something new that you will have to learn. It is true.
hey.
Yes. You
yeah.
see? You see? And ladies are so should you see this one on the necklace? You see how simple
Yeah,
it
baby.
is for you to just ignore?
Yes.
Let
Hey,
me tell yes, let me tell you something. This one please not only breast cancer, I think cervical cancer too is part. Most of
And
those
Hey.
even
cancers that
myoma.
yes,
Myoma
and
too.
yes, myoma good. All those cancers that are capable of, I mean, happening to you ladies, most of them, even not all, most of them, there is a study, okay. Some I think some archives will even give 32, above 32, but most archives will give 30.
Advantage.
So giving birth after 30 years is
That's
considered
very
something like a late stage for you, a female, to give birth, something like that.
Hey.
And it increases your
For mama.
chances of SND.
you
Sorry to
time.
speak. Sorry to speak vernacular. eh? Uh-huh. So
Because
it
of our
increases.
hormones, female hormones.
Yes.
It puts us
So
at
so
risk.
take note, please. Not only breast cancer. Oh. Remember, I'm linking it to other cancers. So if you meet it somewhere and it's not breast cancer and it's some type of cancer, you have a clue, right? So option two is part, just to inform you. Now let us think about option three together. Having previous irradiation of the chest increases the risk of breast cancer. Is it true?
Yes.
Yes.
Yes,
Yes,
it's true.
So previous
it's true.
exposure to radiations can
Radiation.
also,
It's
yes,
true.
that is true. Some people are afraid to say some. Hmm. Say some why? Say some. Number four, experiencing menopause after age 50 increases the risk of breast cancer. True or false?
Not
Not
true.
true.
Not true.
false,
Yes, this
false,
one.
false.
This one to someone did not say some. Okay,
No.
I
option
said
five.
don't know.
Okay, we are all learning. Having so this one is tricky. Let us look at it well. Having a first or second degree relative. I hope you understand what first degree relative
True.
means and
Yeah.
second degree
Yeah.
relative.
It's true.
True.
Yes.
So
It's
having a
true.
first degree, okay,
It's true.
okay. So thank you for getting it wrong.
Oh,
Hey!
Having a
Hey!
first,
We know it's
Yes,
true.
please listen to it well. It is
yeah.
that's how the English will trick you. It is only first degree. Second
but
degree is
they've
not first.
added or
Because of the
second
second
degree.
degree.
See the way they all
Ah,
said. It's
Yes.
true.
You see
what's the
complex
meaning of
questions.
first and second?
Mama,
Okay,
you're
so
bad.
First is the
First,
immediate.
I don't
it's
even know
okay.
the
It's okay. First degree
First is the
relative
there
is
is no
like
immediate.
first degree relatives.
it's like the children
How are
of
you?
your mother and father. Those are your first
The
degree. So your
nuclear
mother,
family.
yes, local family. So your mother, your father, your sisters, your brothers, those are first degree family or relatives.
Okay.
Okay. Second degree is like your mother's sister. like your auntie, your
Cousins
grandmother,
and
your
nephews
cousin,
Extended
and
family.
the extended family.
yes,
That is your second
siblings
degree
and those
relative.
things.
So, yes, really, okay.
So
Yeah, that's your
So,
boy.
yes, so pay attention to it. Only first degree relative is a risk factor, not second degree. So take note. And the last option, having harmful mutations in breast cancer 1. So that's the meaning of this one, okay? Breast cancer 1 or BRCA1 or BRCA2 suppression increases the risk of breast cancer. True or false?
No problem. Yes.
True.
I would say
I
true.
don't know about
I would
you.
say
True.
How can you understand? Because they want to trick you,
True.
right?
Because
Because
of
Understanding the
the
question
the
is part
oral.
of the
second
question.
one, the
Vicky.
second one they've added.
It's like contradicting each other. So
Okay,
Yeah.
okay,
it's
so
false.
so this one, because of knowledge wise, let me just tell you so that we can carry on. Breast cancer 1 and breast cancer 2. Okay. I don't know whether they are actually breast cancer, but that's how I call them. Okay. I don't know whether it's
BRCA1,
even true.
BRCA2.
Yeah, something like that.
BRCA1, BRCA2.
They are naturally occurring genes in you that helps you rather to prevent, or that prevents you from getting breast cancer. These two
okay.
things.
Mm-hmm.
Yes. So
Sir,
take
please,
note
I
of
didn't
them.
hear you. Sir,
I'm repeating myself. These two things helps you and prevents you from getting breast cancer. I'm saying it for the last time. These things, they are genes within you. They prevent you from getting breast cancer. So having said what I've just told you, with the whole sentence, will you pick it as an answer or not?
And then it's
Yeah.
true.
True.
Yeah.
It's wrong.
Oh,
It's
You
false
see that?
because of the harmful.
Yeah. So
having
wait.
harmful
Wait.
Then the
imitation.
You see,
suppression.
aside what I've said,
Ah,
there's also another tricky part of it, of the whole
So
sentence. Look
suppression.
at it. Yes, suppression. So it means you are suppressing the good parts.
Yes.
so it's true. And
Yeah, true.
Yeah, so it's true.
oh,
This is something.
Let me take the last one again. You see, listen to option 6 again. Having harmful mutations in these things, right now, that these things are good things, okay? So when you have harmful mutations in these genes, okay, suppression, these things, they are suppressing breast cancer. I mean, they are suppressing your risk of getting breast cancer. So when you have harmful mutations in them, will
okay.
they increase your risk of getting breast cancer or not?
You
Oh,
do.
okay.
They will.
Okay.
Do you understand it now?
Yes.
Yeah.
Yes.
Yes. So that's how it is. So it's a
Okay.
new thing. Keep it in mind wherever you see them.
Mm.
Okay.
Okay. Thank
I want us to, can we finish with the questions on mastectomy before we go, or we should leave it for another day?
Let's finish.
So that's all the, yeah. Okay. So
Okay.
let us pick up the rest quickly so that we can call it a day. Someone should read this one for us quickly.
The client who had a right modified radical mastectomy 4 years before is being admitted for a cardiac workshop for chest pain, a cardiac workup for chest pain. Which intervention is most important? Determine when client had chemo last. 2. Ask client if she received
Hey, someone is yawning.
adriamycin.
Hey. Okay. So this one will be our last question. Okay. I'm even afraid.
That's why I'm tired.
Yes. After this one, I'm going to ask my brain teasy question. Then we go.
you.
Yes, please carry on.
Okay. 1. Determine when client had chemo last. 2. Ask client if she received adriamycin, an anti-neoplastic agent. 3. Post a massage at
A
the
message.
head of the bed Post a message at the head of the bed to not use the right arm. 4. Examine the chest wall for cancer sites.
Yes, what do you think the answer is?
It's difficult.
Are you sure? Or because the brain is tired? Are you sure it's difficult?
Three.
Difficult.
Three.
It's 3.
Or
3.
Yes, the answer is 3. You are correct. Was it difficult to choose?
no.
No, not at all.
Yeah, so you see, I
Hey,
really spoke of it, right? Those of you who listen to me carefully, I mentioned it when I was talking. Like
Yes,
I used as an example that I've even read some before, right?
Yes.
Yes,
yes,
so if you were listening to
yes,
everything that
you
I was
did.
saying, yeah.
So, so,
So
so
the
please,
answer
I
is
don't
3.
understand why it's the
You
risk
said
for leave
sometimes they
again.
even post it at the doorpost, and then when you go to
Good,
the bedside, so you can see it around.
good. So you were listening to me.
And
Good,
Yes.
good.
I concentrated on the one that you said that they shouldn't
4 years
do any
ago.
blood work on the
So 4
affected
years
arm.
ago.
So you should concentrate on
Four
everything.
years
Not
ago,
some.
there is not.
Okay. So who can help explain it to our sister? Then we can end what we have on the slide here today. Then maybe continue another day.
You said that we should not um set an IV line or do anything IV blood work on that hand, and we should
Good,
not check blood pressure on that hand.
good.
For the risk
So
of
I heard
lymphedema. Yes.
This one is 4 years ago.
so I
Before.
heard it all, but the 4 years ago. I heard
That's
So,
what
that
is
part.
that.
but the
Yes.
client is
Please,
4
wait.
years before.
Please, so let me tell you something.
It's fine.
All that we are saying, even if the person has had mastectomy 200 years ago, it still applies.
so the person came in with
I,
chest pain. So what does
you
the
see,
message at the head?
I'm mentioning 200 years ago so that you know that even if the person was, let's say, an adolescent when she had the mastectomy, even when she becomes an old lady with a stick, walking stick, throughout her entire life, don't use that arm for blood waste. Yes. So it's something that
So
is
then
it
this
is
one
it
is
is
like for
reversible.
life.
Sir,
It's like for
so
life.
It is
so
for life,
sir,
yes, for life. You will not use
some
that
of
arm.
the clients who have gone through mastectomy, like they know that you don't have to use that arm. I've known the patient like that before at URK, and then when
Good,
she came, she was like, "You can't use this arm because I had a
good.
mastectomy, like years ago."
Do
So
you know
most of
why?
them even know already.
This is maybe. Do you know why? Do you know the kind of people who come to how do you call it, Urake? I've heard of the place before.
Yes, I do.
Yes, so you know the kind of people who come there, right?
Yes, I do.
Yes, high, I mean, profile
Profile
people.
people.
Yes. So those
Yes.
people, and please, do you know something? Even among our local
Hey,
areas,
sir,
like,
please, me too. I've gone for MRI there before.
That means a hospital, isn't
oh,
it? I'm
I've
not
oh,
gone for
close.
MRI
oh.
of the spine there
I
before.
am saying that because I want to compare it to something, not that the rest of the
Asameni.
hospitals in Ghana are local. Okay, not that. I just want to say something. Just look at, let's say, a district hospital or somewhere. Even if someone had undergone mastectomy and the doctor or whoever saw the patient has even explained it to the patient, sometimes you don't even care.
Yes.
You see, they
Very
don't care.
true.
Many people don't even know their allergies, even though they will tell them, like they don't care. So you see what I'm trying to say. But um, I don't know. I don't want to use the word educated
But
because
yeah, that is very true.
That is the word.
Some
you
of them,
see,
they don't even know what the chemo even they are taking is all about. So
you see the thing. So that is one challenge. Okay,
Yeah,
but
I will not blame the patients. I blame the health workers. They don't educate the patients well.
We do,
that
pa.
Exactly.
that is also another thing. Okay,
Yeah,
but we will leave it for another day.
without telling
Okay.
patients
let's
why we
speak
are doing.
English. Let's speak English, please.
Yes. We will leave
Hey,
it. We will leave it for another day. So please,
hey.
today you are learning a lot of things. Some things you will not come across them again. You are just sometimes you not even come across them when you are reading. Remember in life class, sometimes we pick information from like lots of places before we bring them here. So some things they'll just flash within your ears just once. Take it because you don't have time. Take it once and for all. Okay. You know
Yeah.
that people who have had mastectomy for life. So if they were 18 years and they had mastectomy for the rest of their life, or like no IV and no blood works on that hand, it applies throughout the entire life of the person. So forget about whether 2 years, 4 years, 15 years. So they are just there to confuse you, these things. Okay, so just be on guard. Okay. And I think with that explanation, we all agree to option three, right?
Yes.
Yes, I have a question.
Okay, you can ask your question.
Why is it that we are focusing on the client past history, but not the current complaint that the patient brought?
Okay, so let's
Like,
look at the question again together. You come in again. Okay, let us see something. The client who had a right modified radical mastectomy 4 years before is being admitted for cardiac work. So why did this person came in for cardiac work for chest pain? Okay, so he came in for cardiac work for chest pain. Let us not add more. But the beginning of the question just gave some history that she had, I said he, this can be he, it's she, okay. She had a mastectomy 4 years ago. So it is just to give you an idea, okay. Hmm. It is just to give you an idea of who the person is, okay. And this person is coming for cardiac work and for chest pain. So we are saying which intervention is most important. Let me give you one trick to answer this question. They don't give you history or the preamble for nothing. That is one thing you can apply it in your question solving and see. Most of the times, I do teach this when we are having live class. Most English questions they come in only 2 sentences, like what you have here. You see, it's just 2 sentences. The first part will give you a preamble to what is happening. Then the last part is the main question that the question wants.
yes.
So you see, why, if our concentration is the chest pain alone and we are concentrating on the chest pain, what why would they give us this history? For what? To do what with this? Are you understanding me? So that is one trick. When you solve a lot of questions, that is one trick. So when someone says give me some tricks, I want to learn some tricks to solve NCLEX questions. These are some of the tricks. But you have to know the knowledge before. If you don't know that, you can draw um blood on the side that had undergone mastectomy. You can't also answer this question. So it's knowledge and practice that will give you the skill or the tricks. Okay. So look at it well again. You have history. I mean, the doing history that this person who had mastectomy is coming for blood works. As soon as if you know this, as soon as you see mastectomy and blood works, they are giving you the reason why he's coming for blood works. Okay. But we are saying which intervention is most important. So you link your answer to the history and to what is about to take place. They are not asking you anything about the chest pain over here. Look at the options. Determine when the client had the last chemo. What does it have to do with
Even the
Wow,
chest
what is
pain that
that?
you're talking about.
yes, even the chest pain? What does it even have to talk about? Okay. So that is how you fish out or you catch their tricks in necklace question. Okay. So it's like some things are tagged to some things. Okay. Um, Most of the times I say when you are solving question and they tell you patient is having difficulty breathing and is having pink frothy sputum. As soon as you see pink frothy sputum, think of only one thing. And it's always one thing. What do you think it is?
Pulmonary
Pulmonary
embolism.
edema. Hey, who is saying
Pulmonary
embolism
edema.
here?
Heart failure.
Please, not heart failure.
Pulmonary
Pulmonary
edema.
edema, not heart failure. Oh. Heart failure can give
Please
you
come
pulmonary
again.
edema. Okay, heart failure can give you pulmonary edema, but please don't go there. It can be pulmonary edema. Don't complicate your answers. Anytime you see,
Please come again on the question.
anytime
Yes.
it's information that I'm sharing, anytime you are solving something, or let's say you are reading a case study, and they tell you the patient is having a pink tint frothy sputum, frothy FROTHY, or like
TB.
I'm telling you something. Okay.
That's right.
Yes, I'm not asking you a question. No, I'm just telling you. Okay, it's not a question that I'm
We are
asking.
interested.
Yes, anytime you are solving, you can check out wherever you check out your kill banks, your wherever you pick up information from. It is one of the tricks I'm sharing with you. Let's say a prioritization question when they tell you a patient with shortness of breath and a pink tinge sputum. So it's either two forms. Sometimes you see pink tinged sputum, or sometimes you see shortness of breath with frothy FROTHY, frothy sputum. As soon as you
Right.
see these two things,
Yes. It's mostly common on the questions.
about
Yes.
about 99% of the time, it is pulmonary edema that is happening. So this is just a free information. You can write it somewhere, and one day, if you've not met it before, you meet it and you appreciate it. Okay. So some of these things they are just there. Okay, there are some of the things that the last time, the last week, was last no, yesterday I was encouraging you that when we come to live class, we shall spend some time to pick up some of these things. Because when you are with, especially when you're doing this, and when you are with USRN, there are a lot of things. Like you can boast yourself, there are a lot of things you can boast yourself with. When you have different people from different English group talking, when you talk, everybody will be like, where are you coming from? You see, it's like going to an international school, meeting with someone who had gone for, it's okay, let me rest my case here. Who has gone to some other schools, right?
I do.
All right. So I think you all agree with me that the answer is the three, right? I want us to rest our case here. Then let me ask you the question, the last take home question. So my question is, are you ready? In the management of DKA, in the management of DKA, which one becomes your priority? Giving IV fluid or
Sir, please,
giving
your
insulin?
voice is down.
Yeah, it's raining here, so please speak a
Okay,
little
okay,
louder.
sorry. When it comes to the management of diabetic ketoacidosis or DKA,
Okay.
which one is your priority between giving IV fluids and insulin?
IV fluids.
IV fluids.
IV fluids.
Okay,
IV
IV.
fluids.
For this
IV
one,
fluids.
it's
Insulin.
down there.
IV
Okay.
fluid because you
IV
want to clear the
Before
total
insulin.
urine, the
Okay.
system.
All right. That is
for
fine.
more
That is correct.
hydration for
And my
clearing
last
total.
question for us to close. This one, I wrote it this dawn. I was thinking about it when I was at shift. Which one will you give? Okay, which of these oxygen delivery devices will you give to a person with tracheostomy? Okay, which one of the following will you give to a person with tracheostomy saturating at 80%? Like it means SpO2 is 80%.
Maintaining
The first one is nasal cannula.
Mental.
The next one, you know my options. you are creating an answer for yourself. First one is nasal cannula. Second one is non-rebreather mask, and the third one is simple face mask. What will be your answer?
Non-rebreather.
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 Okay.
Already asked a wash and then I want to have a drink.
Okay. Okay. So all of you are wrong. There is no answer in this.
I know it was wrong. That was why I was laughing at myself.
You see, you see something. This is how I want you to think. Do you understand tracheostomy? We bypass your upper airway and we've
Yes.
made an incision in front of your neck.
Yeah.
And you want to oxygenate
The
someone
opening is
using the
useless in
nose
your.
or using the baby. What kind of nurse will you be when that happens in real life case?
Is
Don't
it
let
that
it happen.
bad,
Oh.
Max?
Otherwise, you have a big issue. So when you have a tracheostomy in place, the only way the person is breathing is through that hole in front of the neck. So anything you give up is excuse me to say it is nonsense. It's like you don't know what you are doing. Please, do you understand what I'm trying to say?
Yes, please, do we use that
Yes.
valve?
Are you appreciating what I just wrote this thing to draw your attention to
Please come
something?
again.